Hi, this is Austin Brown. I'm going to be describing a ethical dilemma scenario concerning Beth and Corrine. The scenario is that Beth is an occupational therapy student in the 11th week of her first Level 2 fieldwork. She has a full caseload of her own that she is responsible for on a daily basis. Her fieldwork educator, Corrine, has a few patients that she sees on her own without Beth in the room. At the end of the day, Corrine states that she has to leave early and asks Beth to write all the treatment notes, even for those clients that Beth did not see. Corrine states that she wrote down what she did with each client and that Beth can base her notes on that information. Corrine will then sign the notes the next morning. When Beth says that she is not comfortable writing the notes, Corrine states that no one will ever know that Beth wrote them, and if anyone asks, just to lie. Now, there's a couple of potential ethical dilemmas in this scenario. The first is veracity. This states that occupational therapy personnel shall provide comprehensive, accurate, and objective information when representing the profession. In this scenario, because Beth was not in the room, she could not write a fully comprehensive or accurate note on these clients. There is a lot of information that happens during a session. Everything from a patient's demeanor to the exact way that they were able to perform something and notes to be able to show their progress or things that may help in the future. The next potential ethical dilemma is fidelity. This states that occupational therapy personnel shall treat clients, colleagues, and other professionals with respect, fairness, discretion, and integrity. In this scenario, Corrine is unfairly treating Beth. She's asking her to perform an unethical act, knowing that she is in a position of power as an instructor to Beth. This is a lack of respect, a lack of fairness, and a lack of integrity in her relationship towards Beth. On top of this, she asked Beth to lie, furthering the unethical act that she requests of her student Beth. There are a couple of potential action steps to resolve this dilemma. The first is that Beth could tell Corrine that she cannot write the note because it would not appropriately justify through documentation the services provided. She may also tell Corrine that she could not write the note as accurately or comprehensively. The next step would be to reach out to the fieldwork educator or the therapy manager, or both, and inform them of the issue at hand. There are a couple of liabilities to consider. If Beth does as Corrine wishes and writes the note on a client or clients that she did not see, she will accept liability for the action, along with Corrine. Corrine will hold liability for asking a note to be written for her against the ethical standards of accuracy. If the note is written by Beth, the potential of her failing fieldwork and facing discipline from her university is a potential consequence. The documentation may also be audited and could present a risk for the facility for allowing an unethical act to occur. The other professional and liability issues to consider is that Corrine may face suspension or termination. She's willingly and purposefully trying to coerce a fieldwork student into committing an unethical act. The clients and all clients deserve a truthful and honest note. This cannot happen if this scenario is completed to Corrine's liking. My decision for putting the action step in place and why is as follows. This is an opportunity for Beth to educate Corrine on why this is an unethical form of practice. Beth also needs to let Corrine know that she is not willing to perform such an act. Corrine may not have thought it as being unethical and may learn from this experience, helping to keep her from doing something similar in the future. Beth must also consider future students and clients in this scenario. Beth may not be the first student or the last that Corrine has asked to do something unethical. The fieldwork coordinator and therapy manager would be able to advise and counsel more appropriately. This would help to keep it from happening again.